The fall 2025 season of Investigation with Dr. T is proudly centering on our institution's newly designated prestigious R1 Carnegie classification. We're seizing this moment to go deeper, think bigger, and highlight the game-changing work that's happening. So each episode this fall is going to spotlight cutting-edge research initiatives, groundbreaking studies, and powerful doctoral dissertations led by PhD and EDD students, research-engaged faculty, field-based research practitioners, and community partners. So we're going to focus on vital sectors like education, criminal justice, human services, while also welcoming special guests from the College of Psychology, College of Dental Medicine, and the College of Computing and Engineering. And join us as we celebrate our journey into R1 territory and explore what it truly means to lead with research, lead with scholarship, and lead with purpose. So stay tuned. Fall 2025 Investigation with Dr. T. It's going to be unforgettable. So welcome back to Investigation with Dr. T, our final episode tonight of the season. And I am so blessed to have two amazing colleagues with me, Dr. Maria Levi-Minzi and Dr. Cristina Godoy. Dr. Maria Levi-Minzi is an assistant professor. She's an associate professor. Hold on a second now. Let's get this straight. She is an associate professor in the Department of Human Services, is the lead faculty member for the Master of Human Service Program in Child Protection. And prior to that, Dr. Levi-Minzi spent 14 years at the Center for Applied Research on Substance Use and Health Disparities at Nova Southeastern University, and in different capacities. She was project director of public and publicly funded research projects among substance-using populations, including sex workers, people living with HIV, young adults, the elderly, and juvenile justice populations. She serves as a research scientist, analyzing data for publications, presentations, and grant applications. And Dr. Cristina Godoy is the interim dean of research at NSU's College of Dental Medicine. Her work in the program has made educating future dentists and to improve oral health through patient-centered care, academic excellence, research leadership, and commitment to the communities we serve possible. Dr. Godoy upholds the core values of honesty, integrity, and high ethical standards. Please, everybody, please help me welcome these two amazing colleagues and scientists, Dr. Maria Levi-Minzi and Dr. Cristina Godoy. Thank you guys for being here with me for this very special, tonight is the finale, if you will. It's the season finale. You know how season finales usually are very exciting. Well, I'm so glad that I have the two of you to put a nice bow on this season. We've had a lot of talk about research and some really cool, interesting discussions about various populations. And tonight we're going to really, it's sort of like two populations, right? It's the population of dental students and the College of Dental Medicine, which in Fischler, of course, Dr. Levi-Minzi has always been working with the College of Dental Medicine, and I think you've even worked with the, of course, the health sciences in the past also. But so we're going to be like taking a bird's eye view right into the College of Dental Medicine and dental students and what their curriculum, might look like. But we're also looking at pediatric dentistry with the special needs of autism spectrum disorder. So, Maria, do you mind? Let's just jump right in and let's talk about how this all came to be and how we got involved. And when I say we, I mean Stage for Change, the Sociodrama student organization. Tell us about the grant, if you don't mind.
Sure. So I just want to say thank you for having me tonight. It's so wonderful to be here with both of you. So let me just mention a little bit about the grant. So I can't take credit for this grant. Dr. Ocanto was a faculty member in the Department of Pediatric Dentistry at NSU, And it was really his vision that brought forth this desire to run a special needs clinic on campus. And that was really what I think they really wanted to do. So they were able to get this training grant from HRSA, where the grant was giving us funding to actually start a special needs dental clinic on campus at NSU. And I didn't start working on the project, I think maybe 2018, but it had been going on with a postdoc dentist for the pediatric dental residents. It had been going on since like 2015, I believe. Cristina, maybe you can correct me if I'm wrong, but I think it started in 2015 officially. Dr. Chung, who's not with us tonight, but she was a huge part of that effort. And her work as project manager on that grant really helped. And now PI has really helped to bring it forward. But the grant really was focused on first training pediatric dental residents in the care of children with special needs. Because what we have found is that there's rising numbers of children with special health care needs, and it's very difficult for these children who have a lot of difficulties and challenges on their day-to-day lives for them to get, dental care. And I'm sure Dr. Godoy can speak to the fact that a lot of people don't like the dentist. Kids in general might not like the dentist. It can be a scary place, right? People want to get sedation dentistry because they're scared of going to the dentist just to have basic, stuff done. So imagine if you're a child that, has a sensitivity to light and sensitivity to sound and has difficulty communicating, and then they're put in this position. So we applied for another iteration of this grant, and HRSA funded a program for the pre-doc dentistry students. So we had the existing grant for the residents, and then we were able to get the additional grant, which covered the pre-doc students. And it really the goal of the grant was to increase the access to dental care for children with special needs. So by training a workforce of people that were adept at getting, at being able to help and treat this very specialized population. So that's really how it came to be. And I became part of the project because I was the project evaluator. So my goal and my job was to say, okay, they created this training program for all these students. And it had didactic components, which were in class, lectures, but then it also had clinical rotations at the clinic so that the students could work hands-on and have the opportunity to practice the skills that they were learning during training. And so for the purpose of what we're talking about tonight, the D2 students, had the opportunity to have didactic training within their course. And Dr. Godoy was kind enough to allow us to put the training for this for the special needs children in her public health course. And Dr. Godoy, maybe you want to speak to that a little bit as to, you were so wonderful to let us do that.
Sure. So hi, everyone. Happy to be here. So the curriculum or the syllabus of the course was developed in a way to introduce basic public health topics to the D1 students. D1 means that it's their first year. So it's their first year in dental school. And so I didn't want to overwhelm them with public health statistics and things like that. And so I made it kind of interesting to incorporate different topics. One of the topics is cultural competency. And so I thought that by including the sociodrama, which is directly linked to cultural competency as well, they share a lot of the same things. That way we could implement that sociodrama exercise, and by the students being able to participate in that exercise, that would help them learn what are the different things that they can do in private practice when they go on to practice that could minimize these issues that we see every day with seeing kids that have special needs. And so that was the whole purpose of creating the curriculum in this way and to involve the sociodrama. Now, one thing that I'd like to add is that we have 134 students in a class. And so it's very difficult sometimes to engage these students in an exercise. And Dr. T does a phenomenal job in doing that. So I want to thank you for that.
Well, thank you for saying that. Let me just say a little bit about sociodrama, not to take too much time up, but it's scenario-based training is what it is in educational theater, if you will. What makes it very, very unique and different is that usually it's a very short scenario, and in this particular case, the dentist, that's not a real dentist. He's not a dental student. He's not a dental faculty. He's just one of the members of Stage for Change. And I say he because we've had a lot of males play the role, but we also have females play the role as well. It doesn't matter. The dentist's character is supposed to completely misread the child's sensory cues. He does that. He's a bit rude. He's really coming, I think, from a place of pride and ego, and maybe he's even a little insecure, and that's why he seems defensive. He excludes the mother, who has a lot of good information, essential information, and and so it's kind of like highlights, the magazine highlights. You know, the back of the magazine, find the wrench in the tree. What's wrong with this picture, kind of thing. And so we find that showing the bad way to do it, showing the incorrect, ineffective, insensitive, and the list goes on, to show the bad stuff is easily identifiable in the audience. And it's also a little entertaining. But then there's a point where we freeze the scene and we go to the audience and we ask the audience what would they have done differently. And you know, you always have somebody, nonverbal communication is going to tell you, well, I know what I would have done differently. And then you say, great, come on down. And then we put them in, and that's called stepping in. It's a step in technique. And let's see how they do. So I'd like to ask Dr. Godoy, when we freeze the scene, when I freeze the scene, and you start unpacking everything that the dentist gets wrong, what shifts do you see in students' understanding of autism and sensory needs, if any?
So I think that the biggest thing that they realize is that what they thought originally was non-compliance is actually a sensory overload response. And so they start analyzing the situation or the scenario. What things can I do different? And we start to appreciate that autism involves unique sensory profiles. So that means that the environment affects that child, the tone of voice, the pacing, the environment that you create around that child, that all takes effect into their sensory overload. And I think that that's the biggest shift, is when they realize, wait a minute, there's something that I need to change here because this is obviously not working.
Right. I'm going to ask Dr. Levy to come down for a second. And so you know that in our scenario, the dentist completely misreads everything. Why was this autism-centered setup so important to include? Why did we have to include the mother? Why did we include some of the light and the sound and the taste and all of that stuff? Like, so why was all of that so important to include?
So for everyone in the audience, I just want to connect the pieces for a second before I answer that. So as part of this program, as part of this educational program for the grant, the students were, as part of the classroom part, got this lecture on cultural competency, and then attached to that lecture was this sociodrama. And the sociodrama was exactly what Dr. T says. It's a very insensitive dentist, right? And it's a mother who's coming in with her child who has something stuck in their teeth. The child really can't communicate very well what's wrong. And you see these 4 different points in the scene where we stop. So first the mom walks in and she meets the receptionist, who is very dismissive of her, doesn't really listen to her. Then she goes to see the dentist. The dentist is, trying to get in the kid's mouth, like, ignores the mother while the mom's talking, right? And so incorporating these parts into the scene, like having the dentist shine a light in the child's face, and that I think really brings forth what Dr. Godoy was talking about, the sensory overload, right? Like what it must be like for somebody who's scared sitting there. It's already bright. I'm in this weird situation. This person's not listening to ignoring my mom. And, they're trying to get in my mouth, right? And so it was really important for us to present it in that way so that the students could really get a sense of what it could feel like to be any one of those characters. You know,
Great.
obviously the students probably identified with the dentist because they're imagining themselves in that seat. And then it's like the Price is Right, like come on down, we bring somebody from the audience, right, get in here,
Right.
and show us how you do it. But it was really important because I feel like it illustrates for people and really shows them, and it acts it out in a way that, you know, you could abstractly read a case, but when you see it acted out and you're participating in it, it's really more transformative.
Yes, yes. And so, Dr. Godoy, I ask you this question. During the redo, when we have the step in and a student comes, down from the audience and as what do you want to say, the newly improved and revised dentist,
The beta version.
yes, what, what changes in approach or behavior stood out most for you?
I think that they really had a grasp on the different things that they realized were going wrong with the scenario. And so when the newly improved version of that dentist came down, they were very quick to modify the environment. And so kind of go from a task guided thing to more of a relationship building scenario. And so how do I connect with this patient, right? So do I dim the lights like Dr. Levy-Mincy was mentioning? Do they have a preferred object that they would like to touch? So sometimes we give them the little extractor, which is the air thing that sucks all your saliva. So we let them touch it so that they know what it feels like when it goes in their mouth. If we are using a mirror, we let them look at themselves in the mirror. Look, this is how it feels. If we're using a different instrument, we let them touch that instrument and let them feel that instrument. And so you're building trust with this patient at this point. And that's what's really going to help you succeed in any treatment that you do in this population.
So, Dr. Minzy, I'm going to ask you this question, if you don't mind. Um, and that is, even though the grant has ended now, and I was surprised to hear that the grant had ended, but the last time we did this together, it formally had closed. Am I right? And so, why do you continue to do this work? What makes this project too valuable to stop?
Well, I think I can answer this, but also I think Dr. Godoy as well should answer it. But from my perspective, I mean, these are skill sets that every provider should have. And so to me, if you have the opportunity to get this specialized, components integrated into your curriculum, it's only going to benefit you to keep them because you're going to give not only your students an opportunity to expand their minds and learn and become more likely to work with these populations. So you're increasing the workforce, but then you're also making them in a way more marketable. Because one of the things that we learned when writing the grant was that, dentists would get only a couple of hours, if that, of any kind of training on how to work with special needs kids. And so I think that maintaining this is really important. And as part of the grant, we did collect data. The students wrote a reflection paper, where they answered some questions. Like, first, we asked them about how the sociodrama affected their values and their assumptions, and any cross-cultural relationships that they had, and how the sociodrama affected their view of working with special needs patients, and how it might change the way that they practice, right? And we collected, I mean, for the purpose of one of the analysis we did for a paper, we had over 350 reflection papers that we looked at. And, it made a transformative difference for the majority of the students. They wrote about they really learned so much from that short interchange that we did. Just learning the importance of listening, developing a relationship, individualized care, and the patient slash caregiver as an expert, right? And it was so important for them to develop the relationship with the caregiver because the caregiver knows the most about how their child responds in different situations. Going to definitely know more. So if you've got the caregiver on board and working with you, together, you're only going to be more likely to be successful. So engaging and creating relationships, is really like paramount. And I think that really shines through in doing the sociodrama. And I also feel like one of the other things that shines through is kind of understanding other people's contexts and knowing that this dental appointment is just one of numerous appointments that this child is likely going to. And most of the time, children with special needs don't get dental care because this is one of those appointments that falls by the wayside because it's problematic. It's, if it's a problem and it's difficult to go there and it always, they're not, successful during the appointments, the parents less likely to bring them. So I think that if you can continue to get this education for your students, you're only strengthening, your graduates. I mean, Dr. Godoy, you can say more.
Yes.
I think you said all the right things, but adding to that, it just shows you the importance of this topic, because even though the grant has ended, this is still part of the curriculum, and we will continue to leave this as part of the curriculum as long as Dr. T is available. We will continue to have this as part of the curriculum because we think it is very, very important. Until very, very recently, special needs care wasn't even part of the dental curriculum for the pre-doctoral students. And a lot of schools still do not add that to their curriculum. And in years back, when you wanted to specialize to see special care needs children, you would have to do a specialty just for that. It wasn't embedded into your pre-doctoral program. And so this is so important, and we've taken this very, very seriously. And so we will continue to include this as part of the curriculum. I think, and there's just a side note, I think that dentistry has become a business model, and a lot of the practitioners struggle with timing their patients correctly. And one of the things that you have to do with special needs children is you have to allot a lot more time than a regular visit. And so a lot of dentists struggle with making those appointments at a larger scale. And so they want to see 40 patients a day. They just don't want to see 5 patients a day. So that's kind of like a culture that we need to shift a little bit and emphasize the importance of these kids being seen. So that's my 2 cents.
I have another follow-up question for you. From a pediatric dentistry perspective, how realistic was this scenario? And what should clinicians keep in mind when working with special needs children and their caregivers? I think that was something that was really key in the scenario, was that the mother was seen as a challenge, an obstacle for the dentist, the bad dentist, if you will, right?
Right. She was interfering and getting in the way by saying, excuse me, wait a minute, I want to tell you, about my child.
Yes. And there are times that Dr. Levi actually played the role of the mother, and she does a really good job of being like, but one of the things that we brought out on the very last time we did this, October 29th, I think it was, I had Dr. Tara Junkerson with me from the College of Psychology. And so we were able to bring up some other really cool things like, am I feeling as the dentist, am I getting on the defensive? Am I feeling challenged? Is my ego big enough? Am I kind of like confident in my own self, my own sense of self, that I can rely on the mother? In fact, I feel crucial to seeing the mother as integral in this continuum of care, and that she wasn't just an ally, but she was there to help almost translate for the dentist. So, the question again is, how realistic is the scenario, and what should clinicians keep in mind when working with special needs children and their caretakers?
I think it's very realistic. These are moments that define whether a child will trust dental care for life. And so back to what you were saying about the mother, children sense their mother's ambiance, right? And their vibe. Let's just name it like that. I know Maria has the same as me. Our children know our vibe and they can sense it. And so if you build that relationship with the mom or the caregiver, you are also building that trust with that child, because the child is going to see that the caregiver is at ease, and that's going to translate also to what they're feeling, and it's going to make everything a lot more smooth. Another thing is what I mentioned previously, you have to allow time. You have to allow time. You have to allow time to build that connection with that patient so that your treatment is successful, because otherwise it's going to turn into a nightmare. So that's
Dr.
where,
Godoy, can I ask
yep,
you, on
sure.
average, right, in a regular private practice, just to give
Yeah.
people a sense,
Mhm.
is the average time that the dentist spends with a patient like 15 minutes or 10 minutes? What is the average so that we can kind of
I
get a
I
sense?
would say about 15 minutes. By the
And what
time
would
that
this,
the dentist actually goes into the consult, they've already taken their medical history and so on. So the dentist really comes in to do the actual treatment. So I would say between 15 minutes, 20 minutes per
but
patient.
for a special needs patient, it would have to be considerable. They'd have to book like
Yeah,
two,
at
two,
least
two slots, let's say.
correct, correct. At least double the amount of time.
And this
And
is part of the reason why it was so important to create a clinic for this,
yeah,
because
correct.
there was the time slots were large, right? And because in a regular private practice setting, it can be a loss. From the business perspective, you're losing money by blocking off two
Hmm.
sessions for only one patient. And sometimes
Right,
if the patient has Medicare, the insurance that they have, pays
right,
the least amount. And especially in the
right.
state of Florida, there's a
Hmm.
lot of problems with Medicare and dentistry.
Yeah.
So that also kind of was a very important component as to what brought us to, wanting to have the clinic, so that
Hmm.
that there wasn't that barrier for families.
Yep.
This. I'm going to go off book here. Sorry. It's a softball pitch, though. There have been some folks in academia that have criticized the use of sociodrama as less academically rigorous and more just entertainment. What's your take on that?
I have very strong words for that. I would say that in all the lectures, and I'm speaking on behalf of my course, the public health course, in all of the lectures that take place during the semester, the sociodrama exercise is the most popular one. Those are the ones that everybody, I don't even have to ask for attendance. I don't even have to mandate, hey, remember attendance is everybody's going to show up and everybody actively participates in one way or the other. And so I would say that in my experience, in my course, in the public health course, sociodrama is amazing. And it's the most popular lecture of the whole semester.
But is it popular because it's entertaining? See, like
No, I think,
what?
well, because we always read the reflection papers, and you always see that the student translates what they learn, and it's a life learning thing. And they even say so, like that sociodrama has helped them realize the importance of this issue in private practice. And so I would say that that is extremely useful.
Excellent.
I
And
also
I
want to make a
go ahead.
comment. I
Sure.
feel like you shouldn't say it can be entertaining and rigorous and educational. And I think it really serves both. I think it's very
Yeah.
engaging for everyone. If you think about your own career, like Dr. T, like you do a lot of police training, right? Like having an active participant and talking to someone and working on it that way is much more, I feel like, transformative when you sit down and have, and you do a training with somebody in front of you that way,
Yeah.
instead of writing as something on paper. Like it engages you and it changes
Right.
the way that you think and understand.
We also have to think about this new generation, right? The generation now learns very, very differently as to how we learned when we went to school. It's no longer a professor standing up there and lecturing you for an hour. We are trying to find ways in how to engage student learning a lot better. And so one of the things that we're doing is having in-class exercises like the sociodrama. Another thing that we've started to implement is Kahoot. I'm sure a lot of you know what that is, but
Hmm.
we're trying to adapt to how the new generation also learns. And I think that the way that we're teaching them, for example, using the sociodrama, is elevating that student learning outcome that we want to do.
Wonderful. Well, thank you. That makes me feel very confident to continue on with Stage for Change and with sociodrama as a modality in the classroom. Now, speaking of criminal justice, we have a question here from Delilah. In fact, Delilah, I'm going to let you answer it live. I'm going to give you mic privileges, if you don't mind. Can I do that? I'm going to do that for you, Delilah. Where are you? Did she leave? Wouldn't that be funny? I'm going to ask the question anyway. She's not here in the room anymore. Okay, the question was this. The idea of sociodrama does seem extremely transformative. How do we transfer this concept into criminal justice education? I'll answer that. We already are doing that. In fact, the introduction to criminal justice courses have been getting this stop and frisk sociodrama slash scenario based training and very, very highly effective. And that's the ability to bridge the gap between the theory of criminal law, the theory of when can I stop a suspect. So there's the theory that I hear in a lecture, but now I have to apply it. And that's where the rubber meets the road, in my opinion. So yeah, we're using sociodrama for sure in criminal justice education. Okay, so I'm not sure who wants to answer this. This is from Raquel Yates. Are you here? I'm going to let you just ask the question yourself. I just gave you permission. Go ahead. Talking rights. You've got them. Go ahead, Raquel.
Yes, hold on, let me pull it back up. Okay, do you just want both of them or just the one?
Whichever question you want to ask.
Okay. I will just do the first one. Are there any emerging technologies that could enhance or complement sociodrama when treating children with specialized healthcare needs?
Emerging technologies.
I know I'm going to ask Dr. Godoy. I know you guys, because Dr. Chung would talk a lot about the use of simulations for certain
Yes.
types of,
Yes.
I think that you guys have software for that, right?
Yeah. So we've used VR goggles for that, which helps a lot. We were in the process of developing a grant to produce these specialized glasses that are a lot smaller than the goggles, because some of the children with special healthcare needs and sensory issues have a tough time accepting those big goggles in their head. And so we were putting together a grant to develop glasses just like the ones I have on now, but that would also be VR. And so that's one of the things that we're trying to use. A lot of the pediatric dentists now also have TVs on the ceiling. So when the child is laying down, they can watch a movie while they're being treated, and that also helps. It's not really a technology, but a lot of times we use very, very dark sunglasses and we say, oh, look how cool you can wear sunglasses. And so that seems to help because it blocks a lot of the light out. And things like that, I feel like they help a lot. But the VR thing and the simulation, that's like the top thing right now.
Excellent.
And
Excellent.
iPads, do you guys, I know in the clinic they would use iPads too. They had iPads that the
Yeah,
kids could be
we do
engaged
have
with the iPad.
We do have iPads as well. And in fact, we use the iPads for the sole purpose of visual aids. And so visual aids are kind of, think like picture cards that you can show these kids before they actually get treated. And so let's say that I'm going to do a procedure on cleaning their teeth. So we have visual cards and we put them on the iPad, and think of it like PowerPoint slides. And each slide is a picture in in a synchronous order of how the procedure is going to happen. So first you see a child in a chair, then you see a child with a doctor and they're checking their teeth with the mirror. Then you see the child in the seat, and it's comfortable. And the doctor, you see them holding the cleaning instrument and things like that. So the way that works, you're giving the child cues, visual cues, so that they learn what to expect. And now they know what to expect when they're in that chair. And so it makes them feel more comfortable during those appointments.
Excellent. Excellent. So, Raquel, you want to do part two?
Sure. So my second part of the question was, could sociodrama help with the treatment of adults with anxiety caused by visiting the dentist?
Can I make a comment? This makes me think about one of the themes that came out when we were reading the reflection papers too, was the fact that the sociodrama allowed them to feel more empathy and compassion towards the patient. And so I wonder if, and I'll ask Dr. Godoy, I wonder if a sociodrama exist showing anxiety in adult, if that would help to make the dentist feel more empathic towards a patient that was like very anxious.
I believe
Do you
so.
guys do something? Do you guys have anything in your curriculum to address? It's so funny because it's such a common thing that there's anxiety among patients.
Absolutely, absolutely. And you also have now ADHD being diagnosed in older populations. And so I think that you can translate these skills and these tools to the adult population. Why not? I think anything that you think that might help that situation or that treatment for that patient and you have positive outcomes, I say I'm all for that.
Well, I'm one of those people. So I need a sociodrama right away because yeah, I talk about anxiety. I mean, already I have anxiety in general. Now you have to go to the dentist. I think I told the dental students this every time I do the the training, and I say that, I come from a police background. I taught at the police academy for many, many years. So I'm used to teaching police recruits. And police and dentists have something in common. Nobody likes them. I mean, they like them outside, but not to like, tell me what motorist likes to see the lights from a police car in their rearview mirror, and tell me who
Mhm.
likes to go to the dentist for a root canal. Like, I don't think anybody
Yeah,
does.
yeah,
So we should definitely start thinking about maybe using this and spilling it over for adults with special needs. That's a great idea.
absolutely. Mhm.
All right. Here's a question from Valeria. I'm going to give you privileges if you're still here in the room. Oh, I see what these guys did. They like dumped their question and then they ran. Okay, I'm going to ask the question anyway. What are crucial skills that you tell students um, starting starting the track to study to succeed in this field in the future? Crucial skills. What are the crucial skills?
I would say the biggest of all, learn empathy skills, be adaptable, be willing to learn, be very open-minded, be very crucial about the tools that you think are going to help you. No patient is like the other. So I would say, and it's like Dr. Levi said at the beginning, these patients are not just going to come to you for one appointment. It's going to be multiple and multiple appointments. And so document things. If you see that a child shares something personal with you or a little fun fact or something like that, or you want to document specific sensory cues that that child has, then you can prepare for the next session. And so I believe that documenting what's working for you so that you can do that again at the next visit and you can revisit that, then that would help a lot.
Excellent. Josephina, I
Also,
just gave,
can I jump in?
please,
Also, one of the things
please.
that also came up was the importance of training the staff. So
Yes,
like, so we talked about how during the
yes,
sociodrama, you have a very insensitive receptionist.
yes.
So not only the receptionist, but also like the dental hygienist and other people that work in the office, for them to have these same sorts of skills so that there's a consistency and
Mhm.
everyone's kind of on board and has an understanding of, how to manage, these
Mhm.
appointments.
Yep, that's a great point.
Excellent. Josephina, I just gave you mic privileges for your question.
Yes, good evening, everyone. I wanted to know how might the integration of social drama activities and professional training enhance the provider's ability to recognize the psychosocial dimensions of oral health for children with special needs, thereby improving family trust and engagement while they're there.
So I think with sociodrama, you see firsthand a scenario that may take place in your private practice. And so you see firsthand, and the good thing about the sociodrama exercise is that it's not only your thoughts, right? You have the thoughts of 134 students there at the same time live. And so you're getting that feedback that could also help you make certain decisions during that treatment period.
Okay, great. Thank you.
Thank you.
Presley, I'm giving you talking privileges. Go ahead.
Yes. So my question was for what aspects of the act was most successful in, or do you think would be the most successful in shifting practitioner attitudes towards this kind of treatment?
So what aspect of the sociodrama itself? I don't know. Did the reflection papers speak to that at all?
I think that the major thing was recognizing that the mother, in this case, but in general, it would be a caregiver, was your best friend in this, right? And so, and we've already touched on that point. The caregiver is going to know exactly what triggers that child and what things help. Because that's the caregiver that not only takes them to the dental visit, but also takes them to other appointments. And so they already know. So I think that that was the biggest thing, that they recognized that the caregiver was your biggest asset in that appointment.
Great. Delilah, don't worry. I know that you were driving and the connection dropped. We asked your question anyway, and that, I'm glad that you're back in the webinar. Kevin, let me give you some mic privileges so you can ask your question. It's a good one.
Absolutely. So you all were talking about the VR glasses, excuse me, in earlier on in this discussion. And I was just kind of curious, when you're dealing with children with either disabilities or autism or any type of sensory issues, what environment have you noticed is better with the VR goggles? And excuse me if you've already mentioned it. I just didn't, I've been having some sketchy connections here lately. So I was just
It's
kind of
okay. It's okay, Kevin. So the goggles really help. Now, there are children that have sensory issues pertaining to things touching their head. And if you've seen the VR goggles, they're very bulky, they're very big. And so sometimes we struggle with the children keeping those goggles on. And sometimes they might even feel even more uncomfortable with those goggles on. So one of the things that we're trying to develop is having regular glasses be VR. And so because they're lighter, they're just like regular glasses. So those are the things that we're trying to develop currently with a grant, just because some children may not adapt to those VR goggles, but the VR has been a great asset for us.
Okay, thank you so much.
Great. Thank you. Sandy, I just gave you mic privileges. When you say what insights did you gain about communication, empathy, and collaboration, who are you asking? Are you asking the...
Can you go over there and get the box? Thank you. No, like...
Oh, can you hear me?
Yes, somebody
Oh,
wants to
yep.
get the box. I don't know who that was.
Yep, sorry. You
That's
guys gotta
okay.
be quiet. Yep.
That's good. It's not a Zoom bomber, right?
No,
I
not at all.
know, Sandy. I
Nope,
know it's your
no.
kids. It's okay. Well, who are you directing this question to? Like, so what insights, your question is, what insights did you gain about communication, empathy, and collaboration? Can you clarify what you're asking?
Yeah, I was just speaking more in a broad sense. Like how did these things come upon when you were speaking to some of these students?
I can comment actually. One of the things I wanted to mention that came up too in the reflection papers is that individuals that already had personal experiences in their lives with special needs folks seem to relate to this differently. So, and a large percentage of the students, I think at least like 20 or 30%, either had someone in their family that had special needs or autism, a cousin, or they volunteered at a camp over the summer, and they had interactions with these people. And so they already had a level of empathy and compassion and a desire to actually want to work with these patients. And we're very excited about getting this training. It wasn't like just part of, oh, I just got this training and now I love it. But no, it was like, oh my gosh, like I'm so glad that I got this training because, my cousin has autism and, this has been something that, we're very committed to in our family. So I think that, for those people that have special needs people in their life, it only enhanced that empathy and compassion to like another level. And I found that to be kind of nice and inspiring.
Excellent, excellent. So there's one question here, but I feel like we've already answered it. We've already addressed it through the entire program. It's coming from the YouTube chat. What are some challenges that healthcare professionals might struggle with when caring for a special needs child? I feel like we've answered that already, but maybe one of you would like to hit that.
So I would say one of the biggest challenges is time, because you obviously have to coordinate your schedule a little bit differently for these or for this population. And so I think that that's one of the major struggles would be your schedule and timekeeping. One of the other struggles that Dr. Levi mentioned earlier was your office staff. And so you have to make sure that your entire office follows the same concept that you're trying to follow, right? Everybody's on the same page. And so that is very crucial to me, because if you have a front desk person, and that's the first person that this child is going to meet when coming to your office. If you have a front desk person that's going to affect that child negatively, by the time the child sits in your chair, it doesn't matter how empathetic you are, how
Mhm.
funny you are, that visit is not going to be a successful visit. So I think that, like Dr. Levy mentioned, it is crucial to have the entire office trained and to maintain that environment. Anybody can have a bad day here and there, but you have to maintain that environment, especially when you're dealing with this population.
Yes. So I do have a lot of PhD students that are here in the webinar, and after all, this is an episode that is sitting in a whole season of talking about research, research, research. So would you mind, whoever would like to answer the question, and I do apologize because I know that it wasn't one of the questions that I had originally sent to you, but I know you can answer it. The reflection papers are qualitative in nature, correct? And so, can you talk a little bit about your methodology going into the data analysis, and did you create themes? Did you treat this as a pretty formal qualitative study? Can you speak to any of that?
I mean, I can, just because I have a drafted paper on it. So yeah, we did. We worked as a team. Dr. Chung and I went through all the reflection papers, and we did a thematic analysis broken down by question. So we took each question that was asked, and then we analyzed and read through every reflection paper. At the time, this was a couple of years ago, we were not using any qualitative research software. There's some really great software out there, guys, that you can use to help you to do this kind of work now, to make it a little less intensive. But we went through all the papers, and we looked at what they said, how they answered each question, and we broke it down into different themes, right? And so I have some stuff written down here. So for example, for question 1, we asked about their values and their assumptions, and how they might be similar or different from previous experiences that they might have had after watching the sociodrama. And a lot of the themes that we're talking about right now are the themes that actually came up for many, many of the students. So some of the most popular themes were treating the patients with respect, listening and communicating well, having patience with these folks, the importance of the caretaker perspective, recognizing every patient as an individual. Like, we've kind of almost talked about all of them. Having compassion, creating that comfortable and positive environment, like Dr. Godoy said, so important to set the stage for the whole interaction. And then recognizing the difficulties that they experience, like, oh my gosh, what it must be like to have those types of sensitivities, and being knowledgeable about the different cultural differences, and kind of appreciating education and not making assumptions. I think not making assumptions is a really big one. So that was just kind of an overview for question 1. But just to give you an idea, like we did do a thematic analysis on every question. And so we came out, like I said, with the important themes, but it really came through that the experience was really transformative for all of the students. The feedback was really, really positive.
Excellent, excellent. All right, so there's one more that I feel like maybe hasn't necessarily been addressed in the program itself. Brittany asks this really good question, and it almost sounds like it would be like a really wonderful longitudinal study, right? So here's Brittany says, in implementing the sociodrama as a training tool for improving oral health care treatment for children with special needs, what changes in provider behaviors or attitudes have you found to be most significantly influenced by the activity? How do you measure whether these shifts translate into real improvements in clinical outcomes for these children? I think that probably what Brittany is saying is it's one thing to write a reflection paper, and it's another thing to actually shadow a dentist and see if the activity, when we talk about the rubber meeting the road, like did it. So
I can comment on this, and Dr. Godoy will probably be able to say way more. But as part of the grant, we did do an evaluation where we surveyed all of our graduates. And so everyone who graduated from the program, we asked them what kind of setting they were working in and were they actually using the skills now that they're out in the field. So we did have about 20% of those that we surveyed said that they were seeing special needs patients in their practice, and they felt like the training that they got gave them, allowed them to feel confident in treating these patients. So that's from people, this is from the pediatric dental residents, obviously not pre-docs, the residents that got this training responded to our survey over the course of several years. And a lot of them said that they, felt that the training really did help them to see these patients in their practice, and to have like 20% of them saying that they're seeing some of these patients in their practice, to me speaks to, the fact that they did take some of it with them and actually did kind of implement some of these practices.
Wonderful. That's great. Dr. Godoy, any last thoughts?
Yeah, I'll just add that, part of this program and this training is, like Dr. Levi just mentioned, is to have them feel more confident when they go out to practice. A lot of times you see dentists receive a child with special healthcare needs and they refer them out. They decide, it's not worth my time. I don't have the time or the tools for this. I'm just going to refer them out. Or they're generally just scared because they don't know how to address that situation. And so oftentimes they get referred out. And so with this tool, or with these tools, because I'm gonna call them plural tools, we're learning on how to address this need, right? How to close that barrier. It's a barrier, and this is how we're going to bridge that gap. And so by learning different things that you learn through sociodrama exercises, you learn how to adapt your practice around the needs of these children.
Great.
I feel like also, Dr. T, it actually gives them a little bit of an actual, like, concrete skill set. Because if you think about it, right, like, okay, so I'm a mental health professional, and I could read a million different cases about how to work with a client, and then I'm going to suddenly have a client sitting in front of me, and how do I start that conversation? But watching the sociodrama, they got to see how the dentist started the conversation, maybe not in the best way, but then when somebody stepped in, it gave them almost a template for how to start a conversation with a patient, yes, which they might not have seen before. So I feel like it doesn't only help modify their attitudes towards working with different types of patients, but it also gave them like a set of hard skills that, oh, okay, maybe I don't know how to have a conversation with this patient. I'm a little bit nervous. Oh, wait, I saw that sociodrama. This is how they started that conversation. I can do this.
Yeah.
Right. And so to have that, a little bit of a model in front of you is another really transformative piece, I think.
Excellent. Dr. Godoy, last words?
To add on to that, just be able to adapt. Adaptability, I think it's a big thing. Create those relationships, practice on being open-minded with people, just regular people. You don't have to wait until you have a child with special healthcare needs. Just be more empathetic, learn those skills, because those are skills that are going to help you in the long run in your
Yes.
practice.
Thank you to you both for taking the time out of your busy schedules to be here with us on the show. And I really can't tell you how much I appreciate you both, how much I honor your work and respect your work and admire you. And I really look forward to continuing to do this training with you whenever you ask me.
Mhm. Thank you so much for having us.
Thank you. And so that concludes Investigation with Dr. T this particular season, where we were focused completely on our R1 designation, and we wanted to spotlight and highlight all of our various colleagues across all different disciplines and their research. And so we spotlight that, and we get to share and learn from each other. Next season, I'm going to focus completely on our partners. The theme is going to be our partnerships, and we have a lot of them. We have partners with our military and veterans affairs, local and federal law enforcement, the Florida Department of Corrections, Police Academy and training programs, Public Defender's Office, mental health and specialty courts, United Way of Broward County, the Broward County State's Attorney's Office, missing persons organizations, and forensic science and investigation units. So it's going to be really exciting. Partners, just put that buzzword in your head. It's going to be all about the partners for next season. We come back in January, so have a wonderful Thanksgiving. We have a lot to be grateful for. And just thank you all for being a part of this. Thank you, Eddie Hammonds, our project manager, and my assistant. Thank you to Dr. Durham, our dean, and Dr. Castro. And I just really thank all of the guests for taking their time out of their busy schedule. So stay safe, everybody. See you soon.